Welcome to this webinar addressing the federal election campaign, and in particular the healthcare and oncology policy platforms that have been promoted by the parties. We are going to go through what the parties have been saying over the course of the campaign, and let's see now, I just need to figure out how to move my slides here. In any case, I just want to start by welcoming my respondents who have been invited to participate, and thanks. So first of all, a big thank you both to Colleen Savage, who, as Matt indicated, is CEO of the Cancer Advocacy Coalition of Canada, and one of the authors involved in the annual CACC report card, which is, I guess, coming shortly, Colleen, if I'm not mistaken. And also Kathy Barnard, the president of Save Your Skin Foundation. Kathy's becoming an increasingly vocal participant in many of these sorts of events, and has gracefully agreed to give us her perspective along with Colleen as after we review the party positions and their questionnaire responses. So thank you both for participating, and we'll come back to you shortly to get your views on what you're going to hear from me over the next few minutes. So just to give you a bit of an overview beyond that quick introduction, I'm going to go through a summary of the healthcare platforms from each of the 5 main parties that are contesting this election. We are then going to review the CCSN questionnaire that was sent to all the parties, and have a quick look at what each of the parties has said in response to those questions. Once we've reviewed their platforms and their responses, we'll ask our respondents to comment and have a bit of a roundtable conversation about what the campaign has brought in terms of healthcare discussion, and then we will take some questions from you in the audience. Let me ask you to draft your questions as we go. Feel free, please, to type them into the question box on your screen, and when I'm ready, I will deal with the questions as they come in, and some of which perhaps I can answer, some of which we'll have our respondents deal with as well. So yeah, feel free throughout the session to note your questions down, and we'll get to them when we get to that point in the agenda. So thank you again for your attention, and I will just move forward now and talk about first of all the Conservative Party's platform. Excuse me. The Conservatives, as they are wont to do, because they have the view that healthcare is a provincial constitutional mandate, they have taken a relatively hands-off approach, especially when it comes to delivery, healthcare delivery. Their focus has been primarily around the research side and some of the public health components, as well as health regulation, but really have taken a back seat when it comes to healthcare delivery, which is consistent with their philosophical approach. So they've not made a whole lot of, shall we say, showcase promises in regard to healthcare. They have agreed, and I think a positive endorsement of the Canadian Partnership Against Cancer, which would, under a Conservative government, receive a renewal of its 5-year mandate with $50 million a year over the course of that mandate. The Conservatives have also promised $4 million to the BC Cancer Prevention Research Centre, as well as some work, continuing work on their recent modernization of the healthcare regulation framework known as Bill C-17 or Vanessa's Law. The work now is about implementation of that, and so there's a long list of regulations and policies and standard operating procedures and things of that nature that need to be introduced in order to make the law work. So that work will continue. They are also supporting research on a variety of health issues, and cancer being identified as one. As well, they have promised to establish an external or an expert panel to look at the current scope of the adult fitness tax credit, as well as an increase in Aboriginal health funding. The Liberal Party, on the other hand, has made healthcare and in particular collaboration between the federal and provincial levels a centerpiece of its campaign. They're promising to re-engage in an active partnership conversation with the provinces around how to tackle some of the key health issues that are percolating out there. And in particular, as part of that, there's a promise to negotiate a new health accord similar to those accords that were signed under the previous prime ministers, Liberal prime ministers, before the Harper administration. And within the course of that accord, they're promising long-term agreement on funding. They have talked about addressing the affordability of prescription medications, increasing access and reducing costs by bulk purchasing. They've promised to increase their spending, the federal government spending on healthcare over the next 4 years by $3 billion. And in particular, they want to focus on providing services to people in their homes. They are also promising a great deal of infrastructure spending, including things that would support healthcare, such as affordable housing, as well as long-term care homes and things of that nature. And finally, they have agreed and promised to restore the benefits that the Conservative government has removed from refugee claimants as they await their determination. The NDP has stated that it wants to return, or well, I guess to continue providing Canadian health transfers at 6% of 6% of GDP growth on an annual basis. They're not going to be able to do that right away because they have promised to balance the budget. However, it is their intent to return to the 6% standard as soon as they possibly can, as soon as the finances would allow. And they also have agreed and are pledging to negotiate a new health accord, which would be a top priority for them. Like the Liberals, they did make some comments around the improvement of coverage for medications. In particular, the NDP wants to support a universal government-run program. They are promising to invest $2.6 billion over the next 4 years to that end, although it's not their intention to have that as a national or federal program, but rather a national program that is done in conjunction with the provinces. As part of that process, they're hoping to reduce the cost of prescriptions through bulk purchasing with a 30% average reduction in costs as their target, as well as they're going to take the opportunity to streamline the current medication review and listing processes within Canada. They want to set up a $100 million 4-year mental health innovation fund for children and youth. They're going to spend $40 million on a national Alzheimer's and dementia strategy, $500 million to invest in building new clinics and hiring more health professionals. In particular, they are playing on the legacy of the NDP, the Tommy Douglas legacy of supporting universal healthcare coverage, and that's going to be the focus of their energies in healthcare. The Green Party has made a variety of promises as well. The highlight of their healthcare promises is the promise to implement a national pharmacare plan, which it estimates that it would be able to use to reduce costs for prescription medications by about $11 billion a year through following the recommendations from the Pharmacare 2020 group. They also promise more rigorous assessment of new drug applications. In particular, they note the work of the UBC Therapeutics Initiative as the gold standard on which they are going to base their reimbursement decision-making framework, and they're going to do all of this via a new federal crown corporation, which would be given the mandate to purchase prescription medications or to pay for prescription medications, but as a single payer, they see some great savings to be found. They also have promised to extend public dental coverage for low-income youth, as well as they want to work with provinces to develop some guidelines around prevention and efforts to incent Canadians to live healthy, active lifestyles and eat nutritiously. They want to, as a priority, they'd like to have a conference on Lyme disease and develop a strategy to deal with this, what they perceive to be a growing threat, starting with a conference in November of this year if they get elected. They also support the national senior strategy that's been promoted by the Canadian Medical Association and a variety of other health professional and patient groups. And finally, they have also agreed, like the NDP, to increase the Canadian health transfer, in particular to ensure that the provincial demographics are taken into account and as a way to improve equity across the country. The Bloc Québécois has been a little less effusive in their healthcare promises, but they have made a few. One is to increase the Canadian health transfer to 6% per year, as well as address a variety of issues that are related to the demographics and the aging of the population. And in particular, they wanted to ensure that the federal government would get out of the way of the opportunity to open a supervised injection site in Montreal. And just as a note, there's also a group in Ottawa that's trying to do the same thing, and presumably if the Bloc Québécois were in a position to influence it, they would allow that one to go forward as well. So, quick overview of what each of the groups has been saying. I hope that that provided sort of some clarity in terms of the general approach that each of them is taking. Now I want to deal with specific questions that the Canadian Cancer Survivors Network put forward to the various parties. And I'll start by sharing with you the questions that were put forward, and then we'll cover what the what the parties, how the parties responded to those questions. So the first one deals with employment insurance and sickness benefits associated with that program. The questions are, if elected, will your government recognize there's a need for a new process that recognizes that some patients, including cancer patients, experience extended periods of treatment and recovery, and hold open consultations with Canadians about how this process will be developed and implemented? Will you use the results of these consultations to lengthen, improve sickness benefits for Canadians, and ensure the Canadians who are ill are not penalized by the current limit of 15 weeks of sickness benefits? And will you cancel the 2-week waiting period for sickness benefits in order to avoid penalizing ill people? Question 2 deals with disability benefits under the Canadian Pension Plan. There's an explanation of the issue, and questions from CCN are, would your government conduct an investigation into the reasons why 60% of disability claimants are initially turned down? Would you ensure that Canadians are informed about how to successfully apply? And would you provide a tribunal with the resources it needs to clear up the backlog of cases and ensure that necessary resources are in place to prevent the buildup of further backlogs? Regarding the National Pharmacare Program, they ask, CCSN asks, what's the party position on the creation of a National Pharmacare Program? How will the party ensure that the program wouldn't reduce the number or reduce access, basically, to Canadians? And also, would the party support a new equalization payment for National Pharmacare so that there's equity across the country in terms of what the program would cover for the patients in that jurisdiction? And finally, a question about national healthcare leadership. What kind of leadership would the party demonstrate in working with provinces and territories on healthcare issues? How would the parties address the Canadian health transfer and ensure that the transfers are properly reflective of the demographics and not just on population, which is what the current government's approach has been? And please also indicate other ways that the party will show leadership on healthcare. So those are the 4 questions that have been put forward. And as I say, I'm going to just quickly run through the party's responses. We'll start again with the Conservatives. And just to let you know that unfortunately the Conservative Party of Canada had not provided any answers to the questions posed by CCSN. So we are unable to give you the responses. I can tell you that a few of the candidates, have made comments and provided information, but nothing from the party generally. The Liberals, in terms of question number 1, they have indicated that they would be open to reducing the waiting period for EI benefit applications. They have pledged to end the current eligibility penalty for new workers, including those who leave due to illness. They're going to use EI processing as a starting point for a new commitment to higher service standards and direct their efforts at reducing wait times. They will be working to ensure that those who need EI benefits can access them quickly and reliably, and they will introduce a more flexible and accessible EI compassionate care benefit, essentially changing the criteria so that any Canadian who provides care to a seriously ill family member would be allowed to claim their 6-month benefit in blocks rather than in over the course of 1 year, and also provide for sharing of those benefits across family members. In terms of the Canadian pension plan disability benefits, the Liberals are, broadly speaking, pledging to ensure that Canadians have timely access to those benefits. Again, they are making a pledge to improve the level of the higher standard of service and provide a better client experience. They're going to create new performance standards for services offered by the federal government, so that will look at things like improving and streamlining application processes, reducing wait times, and providing money-back guarantees. They're also promising to have all of that performance assessed independently and reported publicly. In particular, they want to reduce the current appeal backlog at the Social Security Tribunal and ensure that the resources are available to ensure future backlogs are not forthcoming. They also want to work directly with the provinces to phase in a fully funded expansion of the CPP, which would obviate the need for the Ontario pension plan proposal that's currently out there. On national pharmacare, while the Liberals have not been are not willing to commit to introducing a national pharmacare program in its own right, they are committed to working with the provinces, with the premiers, to strengthen healthcare and ensure that improvements are made. And in particular, they've made some promises around addressing medication costs. In terms of healthcare leadership, as I mentioned when I went through the Liberal Party platform, they are committing to re-engaging with the provinces, and in particular to develop a long-term agreement, the health accord, that would address a wide range of key issues, including wait times, affordability of medications, home care and community-based services availability, and addressing the demographic challenges that we're faced with. And in addition to that, they are promising to invest $20 billion in infrastructure over the next 10 years that will include spending for affordable housing, long-term care, and seniors facilities. The NDP's responses to question 1 regarding sickness benefits. The NDP has identified a need to increase the flexibility of the supports that for people who are living with chronic conditions in ways that accommodate their level of engagement in the workforce. They're going to look at ways to increase options for persons living with chronic conditions to work. They are going to make a $200 million annual investment in expanding who can receive compassionate care benefits such as EI sickness benefits, and they're going to do that to ensure that it's not limited just to people with terminal illnesses. And finally, they're going to make a $1.3 billion investment in improving the sickness benefit, in particular increasing the eligibility from 15 to 45 weeks and addressing some of the less flexible elements of how those benefits are implemented. On the Canadian pension plan disability benefits questions, the NDP simply commits to having a meeting with the provinces within 6 months of being elected to address national pension plan issues and to negotiate improvements. So nothing specific on disability pensions, but a commitment to address pension issues with the provinces. On national pharmacare, again, like the Liberals, the NDP have avoided sort of making a specific commitment to introducing a federal pharmacare program, but they have made several commitments around improving the affordability of medications and working with the provinces through a national health accord to improve the access via a common formulary and cooperative bulk purchasing of medications. They want to ensure that they're going to lift some of these things out of silos at the provincial level and figure out a way to ensure equitable treatment and access for Canadians to what they term scientifically approved medicines. In addition, they're going to look at ways to improve the current capacity for medication reviews and for beefing up the current joint pricing negotiations that take place through the Pan-Canadian Pricing Pharmaceutical Alliance, as well as looking at inappropriate prescribing and trying to get a handle on that. On national healthcare leadership, the NDP, like the Liberals, have committed to re-engaging with the provinces and participating in negotiation of a health accord. They have specifically promised to reverse the Harper government's cuts to the Canadian health transfer formula. Just to be clear, as of 2017, the CHT is going to be implemented according to the Conservative proposal at growth of 3% or sorry, at least 3%, but it's going to be tied to Canadian economic growth. So depending on how quickly the economy is growing, that will be the opportunity. So what the NDP have said is they're not going to get caught up in doing these kinds of formulas. They're simply going to provide a 6% increase on an annual basis when they get an opportunity. They promised to respect the provincial constitutional responsibility around healthcare, but also to take a leadership role in creating strategies to improve healthcare and make it more sustainable, and in particular, as I said, to build towards the development of a health accord that would address some of the key questions. Like the Conservatives, the Green Party did not respond to the questions proposed by CCSN, so we don't have anything to report there. The Bloc Québécois, however, did respond, and they are, in terms of unemployment insurance, proposing to reform the whole program, including elements that were addressed by the CCSN questions, which would be considered during the conversation that the Bloc would implement. On the disability benefits question, they agreed to conduct, the Bloc Québécois agreed to conduct an investigation into why there's a high number of initial rejections of applications, and also pledged to provide the Social Security Tribunal with resources it needs to address its backlog and avoid further backlogs. On a national pharmacare program, the Bloc Québécois noted that the responsibility for healthcare delivery is a provincial responsibility, and Quebec has a universal prescription coverage within the province, so they are not committing to do anything further in that regard. However, they do note that they're in an area where they would have jurisdiction as the federal government. They would address the way that the Patented Medicines Price Review Board currently compares Canadian prices internationally by expanding the list of comparative countries, and they estimate that by doing so they would reduce costs by 11%, leading to savings across the board. On national healthcare leadership, the Bloc Québécois has committed to expanding the Canadian health transfer to 6%, but more importantly, or more specifically, They also have agreed to ensure that the federal government is contributing at least 25% of health, provincial health expenditures. Currently, the federal government is providing a little less than 20%, I believe it is, as the Canadian Health Transfer falls down to 3% base, that number is anticipated to go down. So they're suggesting that they would maintain a 25% federal contribution, and they also pledged to make sure that the funds would be distributed based on demographics as opposed to strict population numbers. So a quick overview of where the parties are in terms of their healthcare pledges, and in particular for those parties that responded to the direct questions raised by CCSN, what they had to say. So hopefully that gives you a good idea of where the parties are coming from in terms of healthcare and what they're planning to focus on as in the coming days if they get elected. So with that, I want to turn the opportunity for comments to my our guest respondents. And maybe I'll start with Colleen, if you don't mind, Colleen, and just ask you to say a few general comments, and then maybe we'll look at some of the specifics after Kathy's had an opportunity. But do you have any specific, or sorry, general comments to make around the party's positioning on healthcare?
Thanks, Jerry, and thanks for the work that you all did to create this document, which I think is incredibly helpful to all of us, and means that we didn't all have to run out and hire someone to pull this information together. It's good of you to do it and then share it. So on that note of collaboration, one of the things I noticed about all these health commitments is that there's a real split between vague commitments to do something to make things better and very specific commitments to a specific amount of money for a specific activity or event, like money for the Canadian Cancer Society Prevention Clinic and the UBC Prevention Center, money for mental health, that kind of thing. And the rest of it, the things that we've all been sort of screaming for, which is, national standards, work more with the provinces. There isn't as much commitment toward collaboration with the provinces as I would have expected. So of course, with the Conservatives not responding, it's difficult to get a read on what they would really do. Over the last 10 years, they haven't wanted to meet with the Council of the Federation. I was struck by some interviews I saw last week between other analysts and commentators, and one of them from the Ontario Chamber of Commerce said that we should expect more from our government than merely competent management of the portfolio. We should always be looking for vision and leadership as well as mere competence, because business competence from government is not enough. And that we should always look for collaboration between the different levels of government. And from that perspective, I looked over all of these commitments, and I saw not a whole lot of commitment to collaboration other than the parties that we're talking about, commitment to a new health accord, and more sort of incidental and specific examples of leadership and vision were about specific programs, not sort of big picture vision. So I may put something about this in the report card, and I'll talk to you about that afterward, I think. But what struck me was the unevenness all over the place. That I'm not at all convinced they understood, some of them, what they were saying. But anyway, that was my initial reaction.
Thanks, Colleen. That's I think very helpful and useful for us to understand as we consider our options over the next few days before the election. Kathy, do you have any sort of general comments you want to make around what you heard from the parties? So, Kathy, if you can hear me, just make sure you press your mic button before you start to speak. But looking forward to your perspective.
Yeah, it looks like Kathy's got herself muted still. Kathy, all you got to do is click the little mic button that's top left of your screen. It's probably gray right now, and you just have to click the little microphone, and it should unmute you. So I unfortunately can't do it remotely. Oh, there, I think she got it.
Can you hear me okay?
There she is.
Sorry. See, that's what happens when you live out here in Vancouver. You get a little lost in time zone. I also wanted to compliment the CCSN for putting this questionnaire together. These are questions that we've always been asked by our cancer patients, but even more specifically now that the elections are coming. It doesn't surprise me. I have to be really honest. I never ever understood how complex and complicated our healthcare process was in Canada till I got sick. In 2003, when I was diagnosed with melanoma, metastasized melanoma, I thought I would just go in, my doctors would fix me, my healthcare would cover me, and I'd be good. In 2005, when it came back, I had to start searching for my own treatments, find my province to go to, try to figure out how to get my EI benefits. Did I qualify for CPP, disability? And you can imagine in the middle of being told you're dying of cancer that all of those are very complicated issues. So I have to be honest, I'm really new in this, and I think I told Matt and Jerry I did a lot of homework last night because I've really never paid attention myself to what the Health Accord is and all these different national programs or new health accords, Canadian health transfers. And I sometimes think that's the problem with us in Canada is we don't understand the process until we have to be in it. So I'm not surprised about the vagueness from all of the parties, to be quite honest. I spent the last year going province by province to meet with our decision makers. They're all saying virtually the same thing. They need to collaborate more. Federal government needs to work with them more. But I've heard a lot of talk, and I see very little collaboration, and that concerns me. They talk a lot about their experts, who they have is experts in their field, but to be really honest, these are advocacy groups, and us as patients are the experts in the field. We're the ones that have had to struggle through the health care, and I think we need to start advocating more for the process and for ourselves. I heard a speech this morning. I'm actually at the Access to Innovation meeting here in BC, and they talked about the empowered consumer. And I thought, what a true statement, because as patients, we are becoming more empowered now and more engaged than ever. And now we need to start holding people accountable for our care, because it is our care. We elect these people, they work for us, and now we have expectations. So key words to me are engagement, enhancement, collaboration, empowerment. I think these are all things that we have to work with together, whether we're patients, advocates, healthcare professionals, decision makers, so that we are holding these people accountable for our healthcare.
Yeah, Kathy, those are very, it's Colleen again, those are very good points. And as usual, one of the things that comes out of all of this is the importance of patient engagement. Whatever government we're going to have next week is going to have to live up to a bunch of promises and start things happening. And we really need to know that the federal government will start to consult directly with patient groups before making arbitrary decisions about, you know, how to introduce pharmacare or how to introduce a new review process for drugs, or how to, you know, I'm looking at the quote from the Conservative campaign supporting critical research on health issues such as cancer and diseases affecting the brain. Well, does that mean any new money, or is that just the routine stuff that they do every year? I mean, whatever government we have, we need to be sure that they are able to hear our voice and that they recognize the patient voice and they build that opportunity into all of these new ideas and even old ideas.
Thanks, both of you, Colleen and Kathy, for your comments. I think it's fair to say that there's almost no reference in any of the party positions to patient engagement.
Or consultation of any kind, yeah. Other than
well, yeah, I don't even think the word patient, shows up in any of the party platforms, and I guess that's.
It doesn't, Jerry. You're right.
Right, and I guess that's an issue that perhaps the advocacy community needs to take on, because while it's all well and good to talk about things like negotiating a health accord, unless the patients are actively engaged in the conversation, they may not like the results, even if the promise was met, right?
Right.
So just because we should take a minute just to sort of look at the specific questions that CCSN put forward, maybe we can take a quick minute just to see, to get specific comments from you on the party positions on each of the four elements that were raised. I think there was a fairly consistent response of making promises to improve the EI sickness benefits. So any commentary on one versus the other? Kathy, maybe I'll get you to start this time, or things that are missing in those promises.
Well, I think we need to. They talked about the higher standard of service for the CPP disability, but I think we need to look at that right across the board, even through the EI. Firstly, patients, honestly, when you're dealing with cancer, you've got enough to deal with. You need somebody to sort of be helping navigate you through the process that can happen. 15 weeks of EI, well, I've been off work since 2003 till back to 2008. That's 5 years. I think that equates a little bit more than 15 weeks, if my math serves me right. Yeah. And it's the family as well. I like when we talk about, they want to talk about looking at clearing up that backlog. How do we make the application process a little bit easier for us? I mean, really, we need everything at our fingertips. It's easy to navigate, easy to get through to, or we don't even know some of these things exist. We've seen patients that literally have lost their homes because the patchwork of cancer care in this country is so obscene that they're traveling from province to province trying to get a drug that could save their life, that they're not even finding the time to find these benefits, that even though they're not a lot, they're a little bit, and they could at least take a little bit off their plate as a patient. But I think the fact that we even see that there's such a backlog and there's so many people that are denied coverage through the CPP disability, that's just shocking to me.
Yeah. I don't know, Colleen, if you had anything to add to that, or do you want to?
Well, I would just say I think Kathy's absolutely right that one of the most important points mentioned in that whole package under EI was to create a new standard of response time for this and other federal programs. And I like that because elsewhere in your summary, I think somebody, the Green Party or the NDP, was making a commitment to a health accord that would address wait times and cost of prescription drugs and all that long list of things that used to go into health accords. But if we could have a wait times commitment from the federal government for healthcare services and a wait time standard for federal programs to respond to people in need, like cancer patients, for EI and as you say, navigation support for all the maze. If we could get those kind of federal commitments, that does have a tendency to put more pressure on the provinces to improve their own response times. So I liked the idea that there is some attention to the thought of a faster response time from the federal government for processing things that are important to the healthcare, to patients. I like that a lot.
Thanks, Colleen. Appreciate your comments. And just a little reminder to sort of make sure that mic is right by your mouth.
Oh,
so
yeah.
that,
Sorry.
Thanks. No problem. So maybe I'll, if you don't mind, I'll move to the next issue then and ask if you have any comments on the party responses to the CPP disability benefits question. And just before I ask the respondents to respond, I don't know if anybody has questions that have come up in the course of listening to the presentations and the conversation, but if you have questions, please feel free to put them out. I'd be happy to pass them along or address them myself if that's appropriate. So, you know, anybody who has a question, just draft it in the question part of the you know, the control panel that you're working from. So with that note, I will maybe I'll start this time with Colleen. Maybe if you have any comments on the specific issue of the CPP disability benefits and the party responses to the questions.
Well, I mean, I appreciate that there's some interest out there to investigating why so many disability claimants are initially rejected. And again, this comes back to a commitment to a timely response to people. I'm not sure how quickly anybody can make that happen. I'd hate to see an investigation into it turning into its own life form and you know, taking 9 months to come back and say, well, it's because you don't have enough people dealing with it and they don't have clear enough rules to follow and they're not properly supervised. Why don't we just assume that 3 of those things are the problem right now and move a little faster than sometime late next year? So that was my only thought.
Thanks, Kathy. Do you have anything to add to that?
I totally agree, Colleen. You know, we see a lot, you know, meeting and working with the provinces, Well, I thought they would have been doing that previously, so we wouldn't have got into the position we are now with our healthcare budgets. I mean, you know, we again go back to that higher standard of service that we need as a cancer patients when we're dealing with, you know, a sometimes deadly disease. You know, it's still shocking to me that there is such a backlog in the process, and that so many people are being rejected these payments, and you know, when they're fighting for their life. So I don't know. We keep hearing, you know, provinces working together. It takes me back again to us as advocacy groups needing to collaborate more and get into the office of these decision makers to give them the patient's perspective on how quickly these things need to move. We're talking equal timely access in a patient who's dying with cancer, and we need to keep emphasizing that to them, that the process is just too long in a lot of incidents and too confusing for patients.
Yes, I think it's going to mean that, I mean, for most patient groups out here, we have not chosen the federal government as an advocacy target, if I can use that kind of language, because healthcare delivery is, you know, provincial responsibility and blah, blah, blah. I think the federal government will become an advocacy target for a number of these issues, because this is where change is going to have to start, with leadership and collaboration initiated from the federal government to turn all of these things around and simply make it better. So that makes them a more active player in healthcare than we have seen for 10 years. And when they become active again, then we have an opportunity to go and talk to them and say, great, glad you're doing this, do it faster, do it better, and make sure it's patient-centered.
Well, that's actually a good segue into the leadership question, the national healthcare leadership question, and that involves, both this notion of collaboration that you both have been making reference to, but also the promises around, ensuring adequate health transfers. So, if either of you have any specific questions around the different party positions on leadership in healthcare, then I'd love to hear them now. So maybe, Kathy, your turn to start.
Well, I have to say, Colleen, you're probably more of an expert in this, because what I'm finding now is all the different levels of experts in our healthcare system are really, to me, sometimes what's slowing down the processes. We've got new and innovative cancer treatments coming down through the horizon. I didn't even know before 2006 what PCODER was, Pan-Canadian Price Alliance was. Every time I meet with a provincial leader, they talk about their experts, and it seems in Canada we have an awful lot of experts, but I tend to differ. I think we as patients and advocates are actually the experts. We've lived it. We know it now because we've had to learn it. We can tell you what quality of life means to us. I hear a lot about collaboration and experts, but I've never seen it reflect into anything that's really helped a patient. And I want to talk a little bit about research. We're talking about donating these big chunks of money to, other groups and agencies and research centers, and I just always hope there's a watchdog that's actually watching to see where that money goes, because as I see that $50 million a year is going out to a group that probably does fabulous work, I'm also seeing a patient die before my eyes because they can't afford $120,000 for a treatment to keep them alive. So I don't know, I hear a lot of talk, a lot of word collaboration, a lot of meet with, but I don't know, I haven't really seen it resonate for any of the patients that we've been helping over the last 6, 7, 8 years. So when I started the foundation, because I didn't know much about politics, I actually started at a federal level. And everybody that had been around the hood before me said, I think you're starting in the wrong direction. But I'm seeing now it's coming back full circle. I think at the federal level is where we need to start shaking things up a little bit. We need to make whoever becomes our next leader accountable for some of the promises that they've made. And I guess we really need to be the ones that hold their feet to the fire.
You're absolutely right.
Good comment,
I
Kathy.
agree.
Good comment.
Yeah.
Colleen, I don't know if you have anything to add.
I agree wholeheartedly. I mean, I noticed, for example, that the CMA has, a big advocacy campaign on a seniors strategy for Canada, and only who mentioned it in this campaign? The Green Party. I want to see whoever forms the next government responding to the stuff that we've all been screaming about, like, senior strategy, and I want to hear them explain how exactly they're going to fix the review processes for drugs and streamline things and get better prices and make it all more efficient. And as I said before, it's a matter of all of us making sure that we leap onto that federal stage, which most of us have completely ignored for 10 years because there was just no point in talking to them. There was absolutely no point in bothering. Now, if they are going to show an interest in health issues, and specifically those that affect cancer patients, we need to reopen those doors, even if it's just write to the new Minister of Health and introduce ourselves and say, we have an interest in these things. Let's get together before Christmas and start plotting how we can all work together towards something.
Thanks. We're actually running close to the end of the conversation, but I just want to say, let me give you each 30 seconds or a minute to say anything if you want about National Pharmacare, and then we'll close up the conversation for this particular webinar. So maybe Colleen, I'll get you to say just a few words on National Pharmacare and your perspective, and then Kathy, and then we'll wish everybody a pleasant day.
I'm not saying the federal parties talk about National Pharmacare in the same kind of context that I think of National Pharmacare. You know, they're talking about bulk buying, and they're talking about helping the provinces do things like bulk buying. And I think it was the NDP that mentioned a common formulary with no commitment to that being more than 10 drugs. I mean, really, I think we're going to need some clarity around definition of the terminology being.
Yeah, I mean, access.
I'm not at all sure that.
We're saying, right?
Pardon me?
People were not using the word access.
Yeah, I'm not at all sure that when they talk about national pharmacare, they mean the same thing that I mean.
Right. Kathy, I don't know if you have any comments on national pharmacare before we leave off.
Just kind of quickly, actually, and I think I spoke about this a little bit earlier before we went online. I said what's confusing to me is the difference between health care in our country and pharmacare in our country. To me now, as a cancer patient, to me personally, there's a huge difference between both of those, and I need to sort out how, you know, we always lump them together. As far as the cost of treatments or drugs, to me, as a patient and an advocate, that's not necessarily what I'm looking to. And I want to refer back to a document, actually, Jared, that you had, that Pharmacare 2020 plan that was done years ago, and or not that long ago actually, but I'm looking at their overarching principle where all Canadians deserve equitable access to safe, cost-effective, and appropriately prescribed medicines at a fair, affordable cost to patients and society as a whole. As a cancer patient, all I want is equal, timely access to a drug that can save my life. The cost is irrelevant, but it goes back to equal, timely access for Canadian patients dealing with a deadly disease. And I think that's what we need to be looking at yet again, and we still need to be holding those politicians, whoever's elected, accountable.
Excellent. Hey, that was excellent input by both of you. I want to thank you both very, very much on behalf of myself, but also the attendees and CCSN for taking the time out of your busy schedules to come in and help us review what the various federal parties have been saying on healthcare and what impact that might have on the election. So Colleen and Kathy, both thank you so much for taking the time to do it. And on behalf of CCSN as well, I'd like to say thank you to those who participated and heard what we had to say, and we look forward to the next webinar. So I'll pass it back to you, Matt, for a final shutdown, but thanks so much, everybody.
All right, thanks, Jerry, and I'll just echo those sentiments again from our end here at CCSN. Thank you, everyone, for coming today, and hopefully this webinar today has made an impact on your voting choice, or at least given you some necessary context. So with that, we will sign off for today. Look for this webinar. It will also be on YouTube and our SlideShare sometime tomorrow, and you'll get an email about that. But with that, we'll sign off for today, and we will see you all next time.